We've talked about several health headlines this week, and Dr. Payal Kohli is here to break down some of them. Thank you for joining us. So, Dr. Kohli, I know I saw you on in the studio listening in on Brooke's story with us. I wanted to get your reaction. What are your thoughts to hearing all that?
You know, I'm incredibly moved as a person, but as a physician, I feel like her sharing her story is going to make so much awareness of this disease that even we in the medical community know so little about. So, you know, ALS or Lou Gehrig's disease is normally an old person's disease. Average age of diagnosis is about 55, and only about 1 in 10 people get diagnosed before the age of 40. But Stephen Hawking, for example, he had what was called a juvenile form of ALS, which gets diagnosed before the age of 25. So now we're starting to learn that it's actually many different types of diseases. We're lumping them all together because at the end of the day, the final common pathway is the same. The cables that carry the signals from our brain and our spinal cord to our fingers, our voice box, our walking muscles, those are all broken. But really, it's probably very different. Different people manifest it differently. And I think we need more awareness and more research.
Wow.
Yeah. Her story was amazing. It touched me too.
I'm still
just like smiling through all that, and everyone thinks they have problems.
Right.
There really isn't a problem there. Let's switch gears a little bit, talk about LeBron James' son, Bronny. He was rushed to the hospital. We talked about this after suffering cardiac arrest. The heart is your specialty, Doc. Bronny's only 18 years old. What does this mean for his basketball career moving forward now?
You know, Jeff, it's a bit too early to tell at this point, but I'm really encouraged because he has no neurological damage. He has no organ damage. He actually came to the hospital completely neurologically intact. And that really speaks to the fact that he got timely CPR and he got a defibrillation, a shock that reset the heart right away. So the time that his circulation was down was very little. Now, for me as a cardiologist, the biggest question I have before I would let him return to anything is the why. Why did this happen? So like with Damar Hamlin, there was a nice reversible cause, right? He had a structurally normal heart. It was electrically normal. It's just the football hit his chest at the wrong time. And he had commotio cordis, which was the heart was in a susceptible period. He got the chest trauma, and that's what made it freak out. So that's just an accident. Now, in his case, if his electrolytes were low, he got dehydrated, and that's what triggered his heart to misbehave, that would be a reversible cause. On the other hand, if there was something structural found on the testing, a problem with the muscle, a problem with the electricity, then unfortunately it could mean possibly the end of his basketball career.
And let me restate, Bronny. No, I said that wrong. My friend's name's Bronwyn, and we call her Bronny. Isn't that Bronny?
Bronny, yeah.
I'm saying it wrong. That's why I said Bronny. Anyways. I said Bronny. No.
You're forgiven.
Thank you.
Dr. Kohli, Elon Musk, who of course is a peer in the medical community of yours, suggested that Bronny's condition might have been tied or linked to the COVID vaccine. He said that myocarditis is a known side effect. The only question is whether it is rare or common. Can you explain what he's talking about?
I have no idea what he's talking about. So myocarditis, which is inflammation of the heart muscle, can occur from a number of different causes. Of course, the vaccine has been associated with it, but it is much more common, in fact, 11 times more common to get myocarditis from COVID itself than it is from the vaccine. Now, why Elon would reach for vaccine and COVID in a situation where people have been having cardiac arrests as athletes long before COVID or the vaccine ever came into play. So, you know, he's really connecting two dots here that don't need to be connected. We have no idea whether he even had COVID or he's even received the vaccine. So to make a supposition that what happened to him, when we know that cardiac arrests happen in athletes, we know that they happen more commonly in men and more commonly in African Americans. To me, this is just a political agenda.
All right, well, Doc, I'm going to try and squeeze this in. Obviously, we only have a minute left, but we have to talk about Mitch McConnell.
Yes.
We saw that scary moment where he just seemed to freeze and almost go into a trance for, it would seem to be forever. So can you talk to us about what that possibly could have been? Obviously, you didn't examine him.
This is a significant neurological event. 19 seconds of freezing. It could be a seizure. It could be a mini stroke. It could be a whole number of things. And I have to tell you guys, if he did this in my office, I would have rushed him to the ER.
Why didn't any of his peers call 911?
Because I think there's a political agenda here. And I think they really want to try to minimize what happened. But I think our politicians need to be held to the same standards that we all are. And if they're not capable of doing their job, something like this needs to be investigated. And there needs to be transparency.
Wow, I like it, Doc.
Jeez, I know. Thank you so much, Dr. Kohli. DBL Nation, listen to Dr. Kohli's podcast, Heart of Medicine. It is available on Spotify and Apple. Thank you again, Dr. Kohli. We will be right back.
Thanks, Doc.